Dear viewers, we have Dr Sridevi with us. Today, Dr Sridevi, I would like to know for our audience, the uterus grows during pregnancy. We all know uterus that grows during pregnancy. Around 24 weeks it comes to level of umbilicus, the belly button. 36 weeks it comes to Viswanathan, the bone, chest bone. Sometimes it is excessive. People they ask, what, you are only 4 months pregnant but it looked like 8 months, 7 months pregnant. So we would like to know what are the causes which the uterus grows bigger than normal, and next subsequently what are the causes the uterus less than the period of gestation or the period of pregnancy. Sometimes it could be less. Can you educate us, Dr. Sridevi?
Yes.
Over to Sridevi. Yeah.
Sure, thank you. So now coming to the causes where it will be more than the period of the gestation. One is the wrong dates. You don't know your dates correctly. You might think you're 4 months, but actually you might be 5 months pregnant. So first you have to know your dates correctly, and it should be calculated properly. Then the next reason is when you don't empty your bladder. That is when you don't pass urine, that is a full bladder. And third is when there is a big baby. So usually there is a big baby in conditions like when you have diabetes mellitus during pregnancy, then you might have a big baby. Or genetically when you are prone to big pill, then you will have a big baby. And also when you have more than one fetus, that is we call it multiple pregnancies, maybe twins, 2 babies or 3 babies in, then it will be more than the period of gestation. And also when the fluid which protects between the uterus and the baby, when that is very excessive, it should be present, but it is when it is very excessive, then you will have a very big abdomen. And other than this, also when you have some tumor or some swelling in the uterus or in the ovaries. So these may be some of the causes. Other than this, also when in the early period when there is something called a vesicular mode, then also you will have it more than the period of gestation. Very rarely what happens is you might have bleeding before even you deliver. That's known as antepartum hemorrhage. That time when it comes out, you know there is bleeding. Sometimes what happens is it doesn't come out but it stays inside the uterus. So because of the accumulation of the blood inside the uterus along with the baby, then it looks bigger than the period of gestation. So these are a few causes you should think of. Now coming to when it will be smaller. So again you have to know whether you are having your dates correctly calculated. So wrong dates. And whether the growth of the fetus, it grows for that particular, for example for 20 weeks, is the baby growing adequately for 20 weeks. So we call it as IUGR, when there is growth restriction. And sometimes what happens is the baby may stop growing inside. So that's known as intrauterine death. That is the baby dies inside. Then with that the period of the stomach stops growing, the uterus stops growing more further. And same way when the fluid is very less also you will have a smaller abdomen. So these are some reasons where you have a smaller abdomen than your period of gestation.
Yeah, beautiful. Just to add up, the more fluid is known as hydramnios. In medical term they call hydramnios. These kind of people, they are more likely to have congenital anomaly, and diabetes is more common. Congenital anomaly. And also the delivery has to happen very slowly in an institution. This is about more fluid. Less fluid is known as oligohydramnios. That also prone for congenital anomalies. So these some of the causes. That's why we have to check with the medical professional. Doctor to போய் நம்ம செக் பண்ணிக்கணும். ஜாஸ்தியா இருக்குன்னா ஏன் எதனால சொல்லுவாங்க, ஏன் ஜாஸ்தியா இருக்குமா அல்ல கம்மியா இருக்கு அப்படின்னா எதனால கண்டுபிடிச்சிட்டு அதுக்குள்ள வைத்தியத்தை பார்த்தோம்னா நம்ம கரெக்டா டெலிவரி பண்ணிக்கலாம். Thank you very much. Thank you.